Good morning. Today I have two announcements, one regarding boosters and another regarding another mask mandate in St. Louis County. The CDC now recommends a single booster dose of the Pfizer COVID-19 vaccine for those who meet certain conditions. Those include residents who are 65 and older, residents in long-term care facilities, and people ages 50 through 64 with underlying medical conditions such as chronic lung disease, diabetes, and heart disease. Any adult who has an increased risk of virus exposure or transmission because of where they work or reside, such as a group home or corrections facility, may also get a booster. Please consult your regular healthcare provider if you have questions about your eligibility for a booster dose. And for more information on boosters, please go to cdc.org. Only recipients of the Pfizer vaccine are eligible for a booster dose. The CDC and Food and Drug Administration are currently reviewing evidence regarding booster doses for other vaccine types and are expected to make announcements in the coming weeks. Meanwhile, beginning today, our Department of Public Health will offer booster doses of Pfizer at all of our vaccination sites, including our 3 public health clinics in Berkeley, Pine Lawn, and Sunset Hills. Please bring your vaccine card or a copy of the card with you. For a full list of St. Louis County managed vaccination sites, please go to revivestl.com. Even though protection from any of the vaccine types can wane to a certain extent, over time, vaccinated individuals do retain a significant degree of protection from becoming infected or becoming seriously ill if they do have a breakthrough case. Vaccination remains the best way to protect yourself and loved ones from the risk of COVID. Masking and social distancing remain important protective behaviors as well. Masks work in helping to keep our cases from escalating in St. Louis County. That's why our health director, Dr. Faisal Khan, will put into place a new public health order requiring masks to be worn. It was signed this morning and goes into effect immediately. The chairwoman of the council wrote to Dr. Khan last week to assure him that she would not oppose a new mask mandate, and the state legislation does not restrict the executive branch from putting one into place. The council will meet with Dr. Khan and other members of his staff on October 5th to go over the importance of masking during the pandemic. Meanwhile, we have a mask requirement in place to help keep our children safe who are not eligible for a vaccine. And masks help us mitigate the virus while we continue doing all we can to get those who are eligible vaccinated. This new mask mandate will effectively replace the mask requirement that went into effect July 26 and was challenged in court. To be consistent with the judge's orders, we're putting in place a new mask order. As Dr. Khan said in his letter notifying the council of his decision, slowing the transmission of COVID-19 requires a two-pronged strategy: vaccination plus the wearing of masks in all indoor public settings. The pushback against masks has slowed our progress in slowing this virus. The confusion caused by misinformation about masks and vaccines is dangerous. Grandstanding legal actions at the state level have endangered residents here and across Missouri. Wear a mask, get a shot, be anti-government all you want, but defying common sense makes no sense and comes at the expense of those who are at risk of becoming seriously ill or dying from this virus. And I'm happy to answer any questions.
Dr. Page, what makes you think that this order will stand up when the last one clearly had challenges?
Because we're following the guidance of our legal team and the guidance of the judge's orders. And the judge has indicated to us that a new mask order is the best way to manage this question. The previous mask order still stands. There is a temporary restraining order against enforcement. And we believe that issuing a new order is following the guidance of the court.
But the council could vote to overturn this as well, right?
Well, the council chair has indicated that the council has no intention of doing that. The council could do a lot of things, but they've said so far that that's not their intention, and they voted to support it, and that's the current position of the council, and we believe that that will maintain.
Is this an acknowledgement that that aforementioned resolution vote really had no impact? And that's why you had to do a new mask order? Because there was some confusion about whether passing that resolution was akin to saying, we support this mask order.
The question is about the previous vote of the council and their statement in their vote that they meant to support a masking order. They stated it very clearly. The judge has given us direction that rather than extending the previous order, the proper pathway forward in the eyes of the circuit court is to issue a new order. And that's what we'll do. We'll follow the guidance of the court and we'll wait and see what their final ruling is on our ability in St. Louis County to issue public health orders.
There seems to have been a flattening of cases versus where
Right.
we were, say, a month or two ago. I'm wondering why you feel a new mask mandate is necessary now, when it appears at least the cases have flattened at least to some degree.
Yeah, so the question is recognizing that cases are plateauing in St. Louis County, around 230 or 240 on average, a positivity rate of about 8.5%, which is still too high by CDC standards, still falls under the recommendation of the CDC for indoor masking. And we'll follow those recommendations. The guidance of our public health department and our experts and those that we turn to for advice are that masks are still important. Masks are important to keep the virus trending in the right direction. Masks are important to help keep our kids in in-person school and keep our businesses open.
Is one of the things that was notable last week is that Dr. Khan still hasn't been approved by the county council yet. And given that a lot of members of the county council are upset about what he said in the letter to Chairwoman Days, are you concerned that he may get voted down? And what's your what is your plan if his nomination is rejected?
So the question is about the county council's approval of Dr. Khan and his confirmation of Dr. Khan as director. Dr. Khan is the acting director of the Department of Public Health and will continue to be acting director. If the council approves him, then that would be great. If they don't approve him, he will continue to be acting director. That's very clearly established in our charter that the county executive can name directors or acting directors to fulfill whatever needs to happen in county government so county government can run.
So if they vote him down, you're still going to keep him in as health director?
Absolutely, he's doing a great job. And I don't expect them to vote him down, but I guess they could. But I think he's doing a great job, and he's leading the county in a very difficult time. He's great relationships with our experts, and COVID's heading in the right direction, in a large part because of his leadership.
Could there, when it comes to reconsidering whether a mask mandate is necessary, is the decision-making of the Department of Health going to correspond with when the vaccines are available for 5 and up? Is it possible that maybe the mask mandate goes away when the vaccine becomes more available to kids over time?
So the question is about what will the trend, if I understand it right, the likelihood of masks being required when a vaccine is available to children between the age of 5 and 12. It's a complex question, but the mask guidance is directed by the number of cases in the community and the trend of those cases. And that's the primary issue. When we get more kids vaccinated, then we know that the cases will trend down. So the availability of the vaccine doesn't mean that the kids are vaccinated. That just means we can start vaccinating them now. It takes time for them to get vaccinated. It takes time for those vaccinations to take effect. But we will consider our mask guidance and our masking orders based on where we are in cases and after our public health department confers with their experts and experts in the medical community.
Dr. Page, Councilmember Fitch just tweeted moments ago that he believes the legal authority of yourself and Dr. Khan to enact these kinds of mandates is no longer valid? Your response?
I don't know what to say. I mean, we stand by our legal authority. I expect that the anti-mask and anti-vaccine contingent to continue to push back. I believe it's wrong, and I will follow the guidance of our public health department and our experts, and their guidance in masking and vaccinations have helped us get our hands around COVID in our community, have helped us get COVID cases trending in the right direction, and have helped us keep our kids in in-person school. We're following the guidance of the court and the guidance of our legal team, and I believe it to be the right direction.
Can you just reiterate, like, why your administration is fighting so hard for this mask mandate when you've also said that you're not going to aggressively enforce it if somebody doesn't follow it?
So the question is about why the mask mandate is important and why my administration is fighting for it. My administration is fighting for masks and vaccines because it's the guidance of our public health experts. We believe it's the right thing to do. And for the past 18 months, all of our decisions have been based on the guidance and information of our public health department, the experts in our public health department, our advice from our universities and our community, the CDC, and the pandemic task force. And we'll continue to make our decisions based on that guidance. We're fighting for it because it's the right thing to do, and our number one priority in St. Louis County is to protect the health and welfare of the residents of St. Louis County, and that means managing this pandemic based on the guidance of public health experts. We're doing it because we think it's the right thing to do. Any other questions? Okay, thank you.